Hello, I'm Manoj Karmakar. Welcome to issps TV. If you like any of our videos, do remember to click the like and share button. If you are new to our channel, do remember to subscribe so that you can get regular notifications of any future uploads. Hello, welcome back. I think in the interest of some of the speakers that have to leave, we have a slight change in the program. I think if any of you have any questions for Professor Morigal, then this is the time to ask through the chat. So if you have any questions, please do present them. Yeah, and Rossini is our moderator. She's one of our consultants in our department. And Rossini, are there any questions that have been placed for any of the speakers so far?
Actually, there hasn't been any question directed to the presentation content so far at the moment, but just a general question from Dr. Dave Otieno, who's just wondering if they can review these lectures again because they have a difficulty following all the material within such a short time, and whether or not there will be certificate for their attendance after the webinars.
Yes, Dave, welcome. It's been a while since we met each other, but yes, definitely you will get a certificate at the end of the entire session. All the webinars are over. They will be posted to you via email. Next is all the content will be available for reviewing after the end of webinar number 10. We don't want to post it before the end of the entire ISPS because then people would not want to join it live. So only registered participants will get the opportunity to review it. So, and these will be posted after December. So after early December, you will be able to review all of the content. Now, I have a question for both of you, actually. Now, Bernard, when we talk about the costo-transverse articulation, often we read and we often see in anatomical dissections that this space is actually occupied by ligaments, the costo-transverse ligament. And there's a very firm fibrous ligament that attaches the neck of the rib to the transverse process. However, when you look at it in a CT or in an MRI, you see it's like a void space. And in a recent wonderful paper, actually, I'm going to refer to that in my presentation that will follow, is that they have described a costo-transverse space, which doesn't make sense because although that paper has wonderful anatomical reconstructions of a high definition or high resolution micro CT of a block of paravertebral anatomy, they seem to say that the costo-transverse, the space between the rib, neck, and the transverse process is a space with no ligaments. What are your thoughts on this?
Yeah, thank you for this question. May I answer first?
Yes, please.
The problem is, I read that paper and I agree with you, there's something wrong because something in that paper they just took wrong. Apart from the fact that sometimes they mix medial with lateral, that's not the problem. The problem is the level where the scan is done. That means the whole space between rib, neck, and transverse process, it's a high space, okay? And it very much depends on which level you cut that, if it's more or less connective tissue and fat, or if it's ligament. It's just a question of level. So there's definitely a ligament, but it depends on the level where you hit it exactly. And of course, as always in the thoracic spine, it's not the same from T1 down to T12.
So you are saying that at certain cross-sectional anatomical plane, the space is void.
Yeah, you definitely see fat and connective tissue, which gives you the MRI signal. And formerly in the 17th century, this was called the ligamentum collicostae. That means the ligament of the neck of the rib. So that's definitely there. But again, it depends on where you cut it. and it's not directly transversely orientated. That means it's a question of level and how you do your scan.
So that means the ribs are indeed attached to the transverse process at that level with the costotransverse ligaments,
Definitely.
which are the
Definitely.
ligaments. What are your thoughts on that, Ken? Because my first impression when I read the paper was that it's a wonderful description of a lot of anatomy, but as you see here, but is this an artifact that we are seeing and they are interpreting it as a space?
Look at my axial scan here. It's MRI scan through the mid-thoracic spine. So if you follow the rib here, this is the rib articulating with the vertebral body. And this is the costotransverse articulation. Now, there is no signal here. This is all dark. And this represents the thick ligament structures, because thick ligament structures usually don't give very much MRI signal. But then if you look more medially, Manoj, that's the transverse process, the rib, and you see a bit of space filled with fat. And sometimes you can get a vessel in this area as well. So I think, I'm not sure, I haven't read that paper, but I'm not sure if they're referring to this particular space. Once you get through somehow the articulation itself, there is a bit of a space in between. There's quite a long channel. Let me just measure that for you. And that's about 1.5 centimeters in length.
But the problem is, may I add that this is one section of one level. That's
Yes.
exactly at the costotransverse articulation. If you go more caudally, that means at the more end. Now you see clearly. Can you go back that? Can you go one? Yes. And now in the medialmost part, you don't see only fat, you see ligaments. Okay.
Yes.
That is it. It depends on the level. It's only 1 or 2 millimeters that differs in between having fat or having a ligamentous.
That is a very
over here.
Yeah.
And let me add, because I'm a little bit I'm in a hurry because I'm on vacation. I want to leave earlier, if you allow. You will read a complete revision, a letter to the editor about that paper, Manoj, you mentioned. It's an excellent paper, but they did a few substantial mistakes. So you have to read it very, very carefully.
No, I'm pleased to hear your thoughts, Bernard. But I think just looking at the images and the arrows that Ken has just placed on the image, that there's their interpretation that there is a channel from the paravertebral space from one level to the other, or the contiguous spaces through this may hold good, because if you inject into one paravertebral space, then could local anesthetic seep in from this space from one level to another through this so-called costotransverse space?
It is possible.
Yeah, this is something we have never considered in the past, and I think this is an important finding in some respect, because it may contribute to the craniocaudal spread of the drug. Because now,
what are the typical volumes?
Yes, of course, it depends on the volume, etc. But now we are only looking at a extrapleural paravertebral spread, as opposed to a costotransverse space spread. You know, yes, the space is not a continuum from the spinal canal to the tip of the transverse process, if you may, but there are ligaments, and as you two have alluded, that in the medial and lateral aspects are the costotransverse ligament. But that means some of the illustrations in anatomical textbooks are probably too simplistic. They show the entire articulation between the rib and the transverse process to hold the costotransverse ligament.
That's what I said. It's a question of level, because that's approximately the dimension of a rib and the transverse process, what I indicate to you. And not the whole space will be filled with fat, of course. And embryologically speaking, you can understand, because this so-called space is nothing else than a continuation of the transverse foramen of a cervical vertebrae where the vertebral artery goes through. So that's embryological, it's understandable. but it's not just pure fat and connective tissue. That's not true. And what I wanted to point out again, the authors argue this could also be a path for an erector spiny plane block to go to the paravertebral space, and this is definitely wrong.
Yes, I agree. Ken, can you put up one of the sections slightly lower at the articular process level?
Okay, we're going downwards now.
Where the exit foramina is.
Okay, we're coming down. So now going caudal to the transverse process, still here. You can see some ligaments filling this space, but it's not totally fibrous. Not like a sacroiliac joint
That's
fibrous.
what I said. It's not totally fibrous, but on the left-hand side of the image, you clearly see a combination. You see this?
That's right.
There's a ligament
over here
between. That's the ligamentum, ligamentum costo.
Transverse.
Ligamentum collicosta. That's the ligament neck of the rib. It's not the superior costotransverse ligament. It's not the lateral costotransverse ligament.
I can tell you after today, I'm the only radiologist who knows the name of this ligament.
Can you go slightly caudate, please?
All right, we're going caudate now. This is coming up to the tip of the transverse process here. TVPS appearing, and a bit more here.
More.
Yeah. So in the MRI,
stop there.
It's clear that there's also
I have a question here. Now, Bernard, when we talk about the superior costotransverse ligament or the superior costotransverse ligament intertransverse ligamentum complex, usually it is described from the rib, as you said, to the lower end of the transverse process above, and it ends at the medial aspect where the costotransverse foramina begins, or where the posterior spinal nerve root emerges. Now, this study seems to indicate, and with very convincing images, that the costotransverse ligament actually attaches to the vertebral body anterior to the vertebral canal, exit foramina.
No, again, that's a crucial misunderstanding. If you have a look at their drawings and illustrations, they indicate the superior costotransverse ligament to attach to the next higher rib. Really carefully, they're just wrong. It's just wrong.
No, I'm asking you about the medial extension. Now,
the medial extension is clear because there has to be an opening, because the dorsal ramus that goes posteriorly has to go through that. That's why.
What about the ventral ramus? The ventral ramus goes through the medial slit of the superior costotransverse ligament.
No. That's wrong. That's definitely wrong.
But that is in situ images with very high resolution CT, and this I can say can be reproduced using ultrasound. And you can see the costotransverse ligament and the retrocostotransverse space as they have described. But
but no nerve. You don't see any nerve there.
No, you can't see nerve for sure. But as you see, maybe the MRI can illustrate a bit more here. Can you pick up the costotransverse ligament, superior costotransverse ligament here, Ken?
If you see that ligament, it clearly divides anterior, that means ventral ramus, from the posterior, and the opening from the medial side of the superior costotransverse ligament to the vertebral column is just because the posterior ramus has to pass first, and of course vessels. We know that for centuries, so it's nothing new.
I'm not sure if this is what we're looking at. Yeah.
And do you see that it attaches to the transverse process? Okay. And they say it attaches to the next higher rib. It's just wrong. So please read it carefully and wait until the letter is published. And I did a response in detail. There's a lot of errors. Sorry.
Yeah. So the ribs end here, Manoj. This is the bit of the ribs. And then I think Bernard is correct, because now you're looking at transverse process coming in. And then potentially this ligament here is attaching to transverse process and across to rib to the vertebral body.
Yeah, to the
There's
virtual body.
definitely there's crucial and essential mistakes they do, despite the fabulous illustrations they have, but their interpretation is wrong.
Okay, Rossini, any further questions?
So we actually have some comments from the chat box from several attendees. Dr. Noel Apa and also Dr. Ali Salvas-Siddiquis. Pardon me if I cannot pronounce your name correctly. There had just been some discussion on the whether or not there are comments on local anesthetic spread regarding erector spinae plane block and thoracic paravertebral block after with all the anatomy and radiological evidence that was presented by our two wonderful speakers today. So just see if you have any comments on this.
Dr. Siddiqui and my other colleague, I would urge you to just be a little more patient. I think we have an entire webinar number 8, that will discuss at length. We will have the group from Korea, folks from the United States, Dr. Barrington, and those people who have done the work, anatomical, radiological, and then the non-believers like us will also be present, and we will have a good discussion. So I would welcome you to that webinar for that discussion, if that's okay with you. Okay, so if there are no further questions, I'd like to take this opportunity on behalf of all the attendees and our organizers to thank Bernard. You've been a great teacher. Your insights are exceptional, and keep safe, keep healthy, and I will see you soon, my friend. Take care. Bye-bye.